As part of Diabetes Week, I have published a quality statement for diabetes, setting out the key service priorities for the development of better diabetes care across Wales. Diabetes has a significant impact on our population. Around 7% of the population is registered with a diagnosis of diabetes. That's around 207,000 people and their families affected. It's estimated that the NHS uses around 10% of its budget to treat diabetes and the serious complications it can cause. The same study that was undertaken in, I think, 2012 predicted that that would rise to 17% by the mid-2030s, given the likely growth in the number of people with diabetes. So it's clearly a very serious problem for our population and the future sustainability of our NHS. We can already see how the NHS is struggling to meet increased population need for treatment and care. These pressures will only get more difficult to deal with and have yet more serious consequences if we don't act as a society, if we don't come together to address the risk factors associated with conditions such as diabetes, cardiovascular disease and cancer. Now, let me be absolutely clear that type 1 diabetes, which affects around 16,000 people in Wales, cannot be prevented. People with type 1 diabetes tend to be diagnosed during childhood and have to manage through adolescence and into adulthood with vital support from our NHS. But the link between obesity and type 2 diabetes is firmly established. Without a healthy diet and appropriate exercise, obesity can lead to type 2 diabetes over a relatively short period of time. We know reducing body weight by even a small amount can help improve insulin sensitivity and lower the risk of developing conditions such as type 2 diabetes, heart disease and some cancers. We know obesity and physical inactivity are more prominent in areas of greater deprivation. If we're going to avoid some really difficult decisions down the line about what the NHS can provide more broadly, then we need to address these risk factors and their determinants. This includes what we can do in government, what local government does to enable people to live healthier lifestyles, the role of industry and in particular the food industry, and how every single person lives their life. We must all pull in a healthier direction if we are to have a sustainable NHS. Our approach to prevent and reduce obesity rates is set out in our 10-year Healthy Weight, Healthy Wales strategy. We've continued to invest more than £13 million between 22 and 24 to improve access to treatment and increase the focus of partners on prevention. We're using a mix of funding, policy and legislation to drive change.
The Deputy Minister for Mental Health will be making an oral statement on the 27th of June. And this statement will set out our next steps with regard to price promotions on foods and where those foods are located in shops. As part of the strategy, we have also invested £1 million per year into the All Wales Diabetes Prevention Programme. And this programme is being piloted across Wales to help those on the cusp of developing diabetes to put a bit of distance between them and the condition. There have been more than 800 consultations through the programme, and I recently visited the programme alongside Lynn Eagle in Cardiff and the Vale to see for ourselves how it works. As well as this primary prevention, the quality statement for diabetes focuses on NHS support for people with the condition. It includes the development of so-called remission services, where some people with a recent diagnosis can be supported through radical changes to their diet and their lifestyles to reverse the development of type 2 diabetes. the statement places a great deal of focus on good supportive care to help people to manage their diabetes well, including the delivery of routine reviews, diabetes technology and education programmes. And this support will help people to avoid the serious complications of damage to the heart, kidneys, eyes and feet. And finally, we've also included tertiary prevention, where we monitor for early signs of other disease, such as retinopathy, through the Diabetes Eye Screening Wales service. Ultimately, our aim is to prevent people from developing type 2 diabetes, and for those who do develop the condition, to ensure that the NHS is providing the support that people need to manage their condition as best they can. The quality statement is intended to guide the consistent planning of NHS services through the setting out of national expectations and clinical pathways of care. We will work closely with the NHS to implement this through their local planning processes. Progress will be measured through the national clinic audits for diabetes, and we will increasingly make this information public so that we can all see what progress has been made and where we need to focus our improvement efforts. And we will ensure that these expectations are realised through the NHS accountability arrangements. Thank you very much.
Deputy Llywydd, and I'm very grateful to the Minister for this very welcome statement today. And as Chair of the Cross-Party Group on Diabetes, it's really positive to hear the focus Welsh Government is giving to diabetes and the measures being taken and the expectations to address the needs of many who are living with diabetes. And the Minister has already outlined the scale and the challenge ahead of us and the scale of the problem for people living with diabetes. Earlier this year, Diabetes UK asked people living with diabetes to complete a survey as part of Diabetes is Serious campaign. And it's good to see this quality statement reflects many of the concerns raised by respondents in Wales, including on equity, psychological support and the need to utilise technology. And I'm glad to see those recognised today. This statement builds on the good work already happening in the All Wales Diabetes Prevention Programme, the Remissions Programme. They're all deserving of recognition. But what's always clear through every campaign or meeting we have as a cross-party group is the importance of early diagnosis and early engagement. Does the Minister agree with me that we need to do all we can to promote the knowledge about the signs of diabetes, the difference between the types of diabetes and the risks that lead to type 2 diabetes? It must be reiterated that asking for support is important, whether type 1 or type 2 have diabetes, and people should engage as early as possible if they have symptoms of type 1 or type 2 diabetes.
Thanks very much, Jane, and thanks very much in particular for your work with the cross-party group on diabetes. And I think it's really important having these cross-party groups because it does bring pressure to bear on us as government ministers, and I actually welcome that. I think it's important that we're held to account. I'm really pleased that we've been able to respond to some of the points made by people across Wales, and some of the things I outlined in my presentation. Psychological support, it's really serious. You know, people get very upset, and we need to be there, and we need to give them that support. Technology and equity, I think all of those are well understood. So early diagnosis, I think you're absolutely right, and part of what we have to try and expose is, as you say, you know, what are the early signs? What are the early signs? What should people be looking out for? And also, do people really understand the risks? You know, having diabetes, right, okay, well, I've got to start doing this, that, and the other. Actually, the consequence of not managing it properly can be quite serious. Now, I do think it's really important we distinguish between type 1 diabetes and type 2 diabetes. And there's another type of diabetes which is quite rare that very few people talk about. And obviously, we recognise that as well. So I think promoting and helping people to understand those early signs of diabetes is probably not a bad idea. And I'll go back and ask what more we can do in that space. Thank you.